See, I'm actually beating you two.
I'm Marie Hughes and I am Oscar's mum. Oscar was 8 years old when he was diagnosed with a brain tumour. Oscar was a really kind boy, always smiling. It's probably what I miss the most about him, his very big smile and his laughter. He had a very large operation, took all day. The doctor came out and told us he had a medulloblastoma, the most common childhood brain tumour. If it could be surgically removed, there's a 70 to 80% chance of survival, but they survive with potentially quite a poor quality of life. Oscar had radiotherapy for 6 weeks, which was absolutely gruelling. He was going to have 9 rounds of chemotherapy. Unfortunately, Oscar relapsed. When he relapsed, there was really nothing more we could do. So the best way forward was palliative care, and Oscar died here at home with us all around him, with his brothers around him, with me and his dad around him. So there's a lot of side effects that comes with the treatment that Oscar had. If I had known that he was going to die, I would have never let him go through that treatment because it was really that horrible. It was in and out of hospital, it was taking him away from school, it was making him ill constantly, it was making him tired, he was losing his hair. He was so strong. And you'll see that in hospital with these children on the children's wards. They take all this treatment and they do it in their stride and they don't complain. But every once in a while it gets a bit too much. And certainly losing their hair was a bit much for Oscar. The PNET5 Clinical Trial, funded by the Brain Tumour Charity, and the charity that we founded, Oscar's Charity, is part funding biomarker testing here in the UK. Children with medulloblastoma who goes on this trial might be able to have less severe treatment, making it less painful, making it less difficult for children.
PNET5 is an absolute landmark trial for children with medulloblastoma because for the first time we're not treating them all in a very similar way. So we've identified biomarkers in medulloblastoma that can allow us to treat patients differently based on those biomarkers. And the theory is that we can now start to reduce the treatment for those patients with the ultimate goal of reducing the severity of the treatment and reducing some of the side effects of the treatment for those patients. So the motivation behind all that really is to be able to try and individualize therapy for every patient with a medulloblastoma, to be able to use the very latest biological advances to be able to tailor their therapy to the biological characteristics of their cancers.
Since you've finished your treatment, do you feel much better? How much better do you feel? So much better.
Yeah?
Yeah?
Like this big.
Yeah?
Like this big, Mummy.
Really, really big.
Look.
Yeah?
How big?
Alex is a really cheeky boy. He's bright and he's fun and he's brave and he's strong. He's really strong. So the PNET5 trial had only just been launched in the UK, so Alex was the first to go on the trial. Every child is very different, they respond differently. The treatment regime at the moment is brutal, it's really brutal. Anything that can offer a kind of treatment plan has got to be worth it.
So for Oscar, if he had been on the PNET5 trial and he'd been able to have less maybe chemotherapy or different chemotherapy, less radiation, there's a potential that he could have still done some of the sports he was doing, he could have maybe gone to school more, he might not have been as tired. And the idea is when our children go through these treatments, you want it to be as normal as possible, you want them to suffer as little as possible. And for Oscar to have been able to still play with his brothers and not lose all this energy as well, that would have meant everything to him.
So if Alex wasn't on the PNET5 trial, he wouldn't have been able to tolerate the treatment plan, which would have been even scarier. We know as much as we can that we have done everything that we can for Alex to balance survival with quality of life.
We raised a lot of money with Oscar's Charity. We raised about £350,000 now, and I think working with the Brain Tumour Charity means that the money that we raise as a small charity will make a difference. It's really, really important that people keep donating. Testing costs about £2,000 per child. It's a lot of money, but it is money well spent.
If you were to stand 10 years in the future and look back, it would be great if we could look back on a period where we're now able to test a whole series of factors in every tumour routinely, and through that achieve better outcomes, both in terms of survival and in terms of late effects.
We can't go over it. We can't go
Under it.
oh no, we've got to go through it.
Even with the PNET5 trial, with the kinder tailored treatment, the late effects are still severe. So we're hoping that he will have a happy life. He would have benefited from a slightly kinder treatment plan, and that children in the future will benefit from the results from the trial, and that they'll be able to narrow this down even further so that children only ever get what they need.
He would be so proud of what we're doing now, and it is what he would want us to do. And we do this in memory of Oscar, and we'll never forget him. And this work, it means so much to all of us, to his brothers, you know, to make that mark on the world that we always knew Oscar would make. You know, it wasn't the way we wanted to make it, but yeah, Oscar would be very proud.
Go on, Oscar.